It probably comes to no surprise for you that you already know vitamins are very important for us. However, when it comes to diabetics, there are certain vitamins that are very important as they can help maintain overall health, help control blood sugar levels, and can prevent complications that a lot of diabetics can tend to get. On today's video, I'm going to talk about the top vitamins that I recommend for my patients and that you should consider as well, and talk to your healthcare provider about the possibility of having these vitamin levels checked and seeing if you would benefit from them. Before we get started, this is your host, Dr. Diabetics. I'm a board certified APRN here in the United States. It is my passion to teach and educate all of you worldwide. Please consider subscribing to my channel if you are new, share this video, and always feel free to comment below. So let's dive right into it. Number one is vitamin D. We know that vitamin D plays a crucial role in insulin sensitivity and glucose metabolism. Low levels of vitamin D has been associated with actually increasing the risk of type 2 diabetes and causing complications such as heart disease. We know that adequate vitamin D levels may help improve insulin sensitivity and reduce the risk of complications that can occur with type 2 diabetes. Vitamin D is very important, and it's a very simple test that can be done with blood work. So your doctor, your healthcare provider can just order some blood work and have your vitamin D level checked, and you can see if you are low or not. If you are low, making sure that you replace vitamin D is very important. Personally, I struggle with vitamin D deficiency, and I take a vitamin D supplement every single day to make sure that my vitamin D level is where it needs to be. Number two, your B12 complex. We know that B12 is very essential for nerve health and may help prevent or alleviate diabetic neuropathy. We know that diabetic neuropathy, which is a numbness, tingling, burning sensation to your feet, is unfortunately a common complication that can occur with people who have type 2 diabetes. Sometimes people think they have diabetic neuropathy when they in fact only have B12 deficiency. Because B12 deficiency and diabetic neuropathy symptoms can overlap, sometimes those patients will be treated with the wrong medication when all they need to do is replace their B12. Therefore, making sure that you're having your B12 level checked is also important, and it can be part of the same blood work panel as you do when you check your vitamin D level. Routinely, I check B12 for patients, especially if patients are on metformin, because metformin can actually lead to B12 deficiency. And we do see that people with metformin chronic use can tend to have B12 deficiency. Therefore, I make sure I always check it and replacing it if needed. Number three is your vitamin C, a very powerful antioxidant that helps reduce oxidative stress and inflammation in the body. It may also help improve insulin sensitivity and lower blood sugar levels, particularly in people who have type 2 diabetes. We know that we always want to be more insulin sensitive, meaning we can use our insulin more wisely, and we want to have less inflammation, because inflammation chronically can lead to more severe disease and of course can cause certain cancers and other health issues. Citrus fruits, berries, and green leafy vegetables are some of the places we can find adequate intake of vitamin C. Number four is going to be vitamin E, another antioxidant that helps protect from oxidative damage. It may help improve insulin action and reduce complications like heart disease. Nuts and seeds are a great source of vitamin E, so be sure to include more of those in your diet. Number five, magnesium. We know that this is an important mineral that is important for glucose and insulin action. Therefore, it helps keep our blood sugar levels more leveled, and it helps improve the way that our insulin is actually working in our body. Things that include high levels of magnesium will be your nuts, seeds, green leafy vegetables, and also your whole grains. So be sure to include more of those in your diet on a regular basis. Number six is chromium, which is thought to improve insulin sensitivity and better control your blood sugar levels. Good sources of chromium will be your broccoli, whole grains, and lean meats as well. Number seven, omega-3 fatty acids. Unfortunately, we know that people with diabetes are more likely to develop heart disease. Therefore, omega-3 fatty acids are very healthy and can help reduce the risk of heart disease. Fatty fish like salmon, walnuts, and flax seeds are also a great source. Number 8 is your alpha lipoic acid, which is also an antioxidant. They may help improve insulin sensitivity and reduce symptoms of peripheral neuropathy. It can be found in foods like spinach, broccoli, and sometimes you may need supplements for this. Therefore, these are your top 8 vitamins that I recommend for my diabetic patients. Please be sure to discuss this with your healthcare provider. You can get some of these levels checked through routine blood work. These are very essential for keeping your overall health and sometimes improving symptoms that can occur with complications of diabetes. Let me know your thoughts down below, and I'll see you all on the next video.